it lacks a legal mandate, and it contradicts with the Uganda's principle in as far as fairness is concerned. MOs are not sitting for this pre-internship. Nurses are not sitting for it. Where do they get this mandate? Pharmacy students are subjected to this exam illegally, and on top of that, required to pay an amount of 260. After that, then they will sit for the post-internship, where they have to pay 360 and later on pay 550,000. Following this, many students have been sent to the limbo, after some of which have not managed to cross the line of pre-internship. Like recently, we saw a 61% failure, and in the most recent results, we saw one university where we saw candidates, about 107, who sat for this exam, and only 45 passed through. How can we then protect the Pharmaceutical Society of Uganda, knowing that vividly this entity has professionals as lecturers who are teaching these very students, and at the end of the day, they are trying to disqualify their qualifications they get in their accredited universities? Isn't this duplication of academia or of results? How then can you tell us that these pharmacists are not ready for the profession, yet they are taught by you able-bodied, excellent professors and leaders of this country? There is no evidence whatsoever that whoever has passed that internship has actually impacted our community. In fact, our pharmaceutical society in Uganda is in a dire state, in that we are importing over 95% of all drugs we use in Uganda. We have failed to prioritize competence, but rather memorizing molecules that are actually not supporting even our economy in a long run. We see this as a source of extraction of illegal funds and resources from poor students who come from all the way up country, from families that have sold their cows, their cattle, just to make sure that this student goes to school for 5 good years. And this student then, he is denied a right to go for pre-internship under the guise of a bureaucratic overreach of this exam.